Welcome to AskJanny TV, your home for real conversations, health education, insights, and inspiring stories. If you enjoy our content, don't forget to like, share with your friends, and subscribe so you never miss an episode. Your support helps us grow this community. Let's get started. Complications of newborn jaundice. Most newborn jaundice is mild and harmless. However, when bilirubin levels rise too high and are not treated on time, complications can occur. These complications are rare but important to understand. Yellow 1. Acute bilirubin encephalopathy. This is the early, irreversible stage of brain injury caused by very high bilirubin levels. Bilirubin builds up in the brain tissues and affects normal brain function. Early signs may include very sleepy or difficult to wake, poor or weak sucking, high-pitched cry, floppiness or decreased movement, irritability or unusual behavior. Why it matters? If treated early, usually with phototherapy or exchange transfusion, it can be reversed. Brain 2. Kernicterus. Kernicterus is the permanent, irreversible form of brain injury due to extremely high bilirubin. It occurs when bilirubin crosses the blood-brain barrier and damages specific brain cells. Long-term complications of kernicterus include permanent hearing loss, cerebral palsy or movement disorders, especially dystonia or athetoid CP, problems with muscle tone, too floppy or too stiff, learning difficulties, poor dental enamel, which is yellow and weak teeth. Kernicterus is preventable with early detection and treatment of jaundice. Heart 4. Anemia. In cases where jaundice is caused by blood group incompatibility, which is ABO or RH, or hemolytic disease, rapid breakdown of red blood cells can lead to anemia. Severe anemia may require treatment such as blood transfusion. Medical staff 5. Seizures. Extremely high bilirubin levels affecting the brain can cause seizures, which is a medical emergency. Sad face 6. Developmental delay. Untreated severe jaundice can affect brain development, leading to delays in speech, motor skills, or learning. Flower, key reassurance. The good news is that nearly all complications of jaundice are preventable with early and frequent breastfeeding, routine bilirubin checks before discharge, and early follow-up after going home.
Prevention of newborn jaundice is simple, reassuring guide for parents. Jaundice is very common in newborns, and in most cases, it is harmless and easy to manage. Still, there are simple steps parents can take before birth, right after delivery, and in the first week of life to help reduce the risk. Before birth, a healthy pregnancy supports your baby's ability to handle bilirubin after birth. Attend all antenatal visits so healthcare providers can detect conditions like blood group incompatibility, ABO, or RH. Discuss your blood group and rhesus factor with your provider. If you are RH negative, you may receive medication, anti-D immunoglobulin, to prevent RH incompatibility in future pregnancies. Maintain good maternal nutrition and hydration, as this helps reduce risks like prematurity, which increases the chance of jaundice. Immediately after delivery. The first hours after birth are important. Start breastfeeding early. Begin breastfeeding within the first hour of life. Feed 8 to 12 times in 24 hours to help your baby pass stools. This removes bilirubin from the body. Frequent feeding also prevents dehydration, a major contributor to jaundice. Routine monitoring before going home. Your baby should have a bilirubin check before discharge, especially if early discharge is planned. Nurses and doctors will examine the baby's skin and eyes for yellowing. Ask questions if you are unsure. Your concerns are always valid. During the first week of life, 1. Keep breastfeeding and ensure good hydration. You know your baby is feeding well if they have 6 or more wet diapers per day by day 4-5. They pass yellow, seedy stools for breastfed babies. They feed actively and come off the breast looking satisfied. Avoid giving water or hatchers. Breast milk alone is enough and safest for newborns. If your baby is struggling to latch, seek help early from a nurse, midwife, or lactation consultant. 2. Save sun 10 to 15 minutes near a window may help lower bilirubin levels slightly. Do not place the baby in direct sun or breastfeeding poorly. This visit allows early detection before jaundice becomes severe. When to seek help urgently. Contact a healthcare provider immediately if you notice very deep yellow skin or eyes. Baby is too sleepy, difficult to wake, or feeding poorly. High-pitched cry. Few wet diapers or little stool. Any worrying change in behavior. These signs may mean bilirubin levels are rising too high and prompt treatment is important. Final reassurance. Most newborn jaundice is mild, temporary, and treatable. With early feeding, simple monitoring, and timely follow-up, parents can confidently protect their baby's health.